The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. Today we're going to be talking about fire. Fire in your arteries. Do you have fire in your arteries? If you do, you're going to want to put it out. And talking with us about this vital subject today is Dr. Tim Arnott. He's a physician from the Lifestyle Center of America in Oklahoma. And all day, doctor, you help people put fire out that's in their arteries, don't you?
That's true, we do.
And what does this really mean, fire in the arteries? What does it mean, fire raging in the arteries?
Well, inflammation is the word that most people are probably familiar with. And it has to do with the immune system. It has to do with the white blood cells. The truth is that when you have too much cholesterol and saturated fat in your diet, and that is then put into the bloodstream, and so you have high levels of cholesterol in the bloodstream, levels that are higher than they should be, and you're not taking enough of these pigments in the fruits and vegetables, you're not getting the antioxidants in the whole grains and in the seeds, then this cholesterol can become oxidized or chemically injured or damaged. And when that happens, the cholesterol is actually in a state of such toxicity that the white blood cells see it and they absorb it, they take it up, and they put it into the wall of the artery and sequester it there. And this whole process of getting the immune system involved in getting rid of the excess cholesterol leads in many cases to an elevation in inflammation.
So that's the fire.
That's the fire, that's correct. And it's these chemicals that the white blood cells are sending to each other that we can actually measure. Now,
you work at the Lifestyle Center of America. You're a medical doctor there. You're specialized in family practice. And there at the Lifestyle Center of America, you help people all the time know whether or not they have fire in their arteries, so to speak, or not, whether or not they're inflamed or not. How can you tell whether or not you have this going on in your arteries?
Well, actually, every patient that comes through Lifestyle Center of America actually gets a test called a CRP, or a C-reactive protein. This is a protein that's put out, it's made by the liver, right up here under your rib cage, and that protein is put out in response to an immune system, a white blood cell army that's mobilized and actively dealing with the cholesterol that is accumulating in your artery wall and that's accumulating in your bloodstream.
Okay, so this was pretty popular. I mean, I heard about it first just not too long ago, and so it's actually pretty specific. It can tell you what kind of fire and how big it is.
Absolutely. What it's exciting about it is that it measures and it actually is able to detect low levels of inflammation. I mean, we have a SED rate test, a red blood cell sedimentation rate that can measure more robust and greater levels of inflammation in the body. But there is actually a level of inflammation that is not high, it's low, and it's found just relating to your arteries and that cholesterol material that may be building up there and what the white blood cells are doing with it.
I see.
And that low level of inflammation is very important because people that have more of that are at greater risk for a coronary event like a heart attack.
So this is why it's important to know whether or not my arteries are inflamed.
Absolutely.
Because if they're inflamed, if that C reactive protein, did I say that right?
That's correct.
And C stands for what?
Well, I don't know exactly what it stands for. That's just the term that's been given.
Okay.
C
reactive protein.
Reactive
it tells
protein.
me that there's a real problem there, and I need to, if it's elevated, I need to watch out because this can really damage my arteries. And
what they've discovered is that individuals can have normal, or what's considered by our government as normal LDL, or bad cholesterol levels, But if they have a high C-reactive protein level, which means if they have a lot of inflammation, even though their cholesterol level may not be that high, they are still at significant risk for a heart attack or other coronary event.
So how do we put out the fire? Let's say we had our C-reactive protein. What's the normals for that? I mean, is it 1, 2,
well,
3,
you want
4,
to get
5?
it less than 1.
Okay, less than 1. Let's say it's greater than 1. Let's say I have a 3. Maybe
well, if you have a 3, that's actually getting you up into a higher risk category.
Okay, let's say I have that. What do I do to put out the fire?
Well, one of the things that it has been shown early on, a number of years ago, is that individuals who are eating the most fiber actually have the lowest C-reactive protein levels. Now, even more recently, just last year, Dr. Kendall and his colleagues at the University of Toronto in Canada showed that you could actually significantly lower C-reactive protein. In fact, you can lower it about as much as one of these statin drugs, Lipitor, or Zocor, Mevacor, by doing the following. By taking individuals and putting them on a plant-based diet, and including as part of that plant-based diet, remember on an earlier program we said you could be vegetarian but not necessarily healthy vegetarian or optimal vegetarian. Well, he tried to make it a plant-based or vegetarian diet that was optimal by making sure they were getting some almonds as part of their diet, making sure they were getting 25 grams of soy protein, making sure that they were getting some of these phytosterols. These are steroid-like compounds in the plants that can actually help block cholesterol uptake out of your intestine into the bloodstream, sending that cholesterol on out of your body. And they were giving that in the form of a margarine. So they were giving them some focused foods that have been shown to help lower heart disease risk. And sure enough, they were able to lower C-reactive protein levels, and they were able to lower total cholesterol levels about the same as a statin drug like Zocor.
So increased fiber, increased complex carbohydrates or foods is grown, that has been shown to put the fire out in the arteries.
Actually, that's correct. And the other thing that it's important for people to understand is that there are some fats that are found in the animal products, red meats, for example. This arachidonic acid, it's an omega-6 fat, and it is a fat that can only go one direction once it's inside the body. And it goes in the direction to make some of these specialized chemicals, prostaglandins, for example, and it only can make prostaglandins that promote inflammation, that promote blood clots, that promote arteries constricting. And so when you take in animal products, you don't give the body a choice. When you take in meats, for example, you force the body to rev up
the fire.
The fire, yes, exactly. Now, the other thing that can happen, even if you're eating plants and you're getting more of the omega-3 fats and you're getting more of the omega-6 fats, there can be a problem if you're getting those omega-6 fats in the form of corn oil and safflower oil and sunflower oil. For the reason is that they are so rich in omega-6 that they can get in the way of your using properly the omega-3 fats that are found in walnuts and flaxseed, for example. And so you can actually rev up inflammation that way as well, because it's the flaxseed fat, the omega-3 in that, and the walnut, the English walnut omega-3 that can reduce inflammation, reduce blood clots.
So flaxseed is beneficial because it reduces the inflammation.
That's correct.
Now you have a couple of graphics on this flaxseed issue. Let's look at that and talk a little bit about it.
Dr. Hugh and his colleagues at the Harvard School of Public Health have looked at the intake of alpha-linolenic acid.
And I see they have a level of 1 there versus a level of 0.5.
That's correct. 1 would be the greatest risk of a heart attack. So a long bar means lots of risk for a heart attack. If you have a short bar, and as you can see there, it's about half the risk of having a heart attack. And then you look over to the side, and it says highest intake of alpha-linolenic acid. Well, that is the omega-3 fat that is concentrated in your flaxseed, it's concentrated in your English walnut, and it's in your dark green leafy vegetables. So individuals in their study that had the highest intake of those specialized omega-3 essential fats found in English walnuts, found in flaxseed. And by the way, you can get either dark brown or blonde flaxseed, or dark greens. They have the lowest risk of a heart attack.
So in other words, you may have a salad out of really dark greens and put some walnuts on top.
That's exactly
English
right.
walnuts.
Now, interestingly enough, we were talking earlier about how you can have a generally not so healthy food product, but it's got some benefit in there because of it comes from the plants. And in this study, actually, they found that individuals were getting their omega-3 fat, this alpha-linolenic acid, from salad dressing, which is made largely from soybean oil. And because soybean oil has more of the omega-3 in it, they were actually getting protection from that. But you're going to be much better off to eat the soybean.
So where would someone get flaxseed that wants to use that, or these different kinds of things? Can you buy flaxseed at the supermarket down the street?
Well, you know, it depends. If you live on the West Coast, if you live in the South, if you live on the East Coast, you probably can. If you live near the Lifestyle Center of America, you're probably going to have to go to a health food store, or you can join a co-op like we do. We have a relationship now with the Country Life Foods there in Michigan, and they send us 5 pounds, 25 pounds of flaxseed, blonde, brown, you name it.
And I understand that you have to grind it up or else you won't be able to utilize it.
Well, you can utilize it if you don't grind it, but it'll be a laxative rather than getting you the essential fats. So that's absolutely right. You want to freshly grind it. A coffee grinder is the perfect tool to grind up those flax seeds, and you want to take in 2 tablespoons of the whole seeds, not rounded, just flat tablespoons of the whole seeds, grind it up, and you want to do that every day. And that'll give you just about as much blood clot preventing power as someone who eats fish, say 3 times a week, because there are omega-3 fats in fish as well.
So there's a fire in our arteries. That fire comes from inflammation. Just to summarize, we can figure out whether or not we really are having that inflammation by a C-reactive protein test that your doctor can run, or you can do there at the Lifestyle Center of America. And we need to know whether or not we have inflammation, because if there's a fire in our house, we want to put it out. And the way to put it out most aptly is to eat foods that are high in fiber, foods that's grown, and to have flaxseed.
Flaxseed, English walnuts, and leafy greens. And to avoid a lot of those processed oils, which they're so rich in omega-6, they can dilute the benefits of your omega-3 fats.
Well, you know, there's a lot of discussion about fats and how they relate to heart disease, how they relate to the fire in our arteries and different things. And there's some confusion, frankly, about that. And we want to talk about that a little more. And I'm sure you educate people there at the Lifestyle Center of America about these different things when they come through the program. And they see things turning around. We're talking with Dr. Tim Arnott. He's a physician at the Lifestyle Center of America in Oklahoma, where they help stop, reverse in some cases, or prevent the common killers in America. When we come back, we're going to talk a little bit more about the fire that many people have in their arteries and how to put it out. We hope you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Tim Arnott. We've been talking about something that kills millions of Americans, that being heart disease. We have noted that this is somewhat likened as a fire in our arteries because of the inflammation that comes as a result of those processes in in the arteries, and we need to put that fire out. How do we tell whether or not we have that fire? There's some special tests like C-reactive protein, and Dr. Arnott is a specialist in helping people reverse the common killers with lifestyle medicine, and he works at the Lifestyle Center of America in Oklahoma. You're a family practice physician, but you've specialized in this. There's programs they do there, a 19-day program. They also do programs or developing programs that people can even find in their own communities now, like the Wellspring program. We've talked about how to stop this inflammation. We've talked about having the kind of foods we need to have high in fiber and greens, as well as foods as grown. We've talked about having flaxseed or these other different things in our diet. I want to talk a little bit more about flaxseed. You told me in the break about a very fascinating study that I think we need to bring out.
Dr. de Lorgeril and his colleagues actually found individuals who had already had a heart attack, and they put half of those individuals on what's called a heart-prudent diet, basically an American Heart Association style diet. They put the other half of those individuals who had already had a heart attack on a diet that was rich in alpha-linolenic acid. Now, this is the essential fat that we cannot make. We have to eat it. We have to get it from our food. It's made only by plants, and it's richly supplied in flaxseed, English walnuts, and dark leafy greens. They followed these individuals for a number of years, and what they discovered is that the individuals who were on this diet rich in this omega-3 fat, they had a 70% lower risk of dying than the individuals who were on the heart-prudent diet.
So this graphic that we're going to look at is going to show this.
Absolutely. As you can see here on the top line, you can see that individuals who were on this usual post-heart attack prudent diet,
like the Heart Association
the
diet.
Heart Association diet, they had the greatest risk of death after heart attack, shown there by the longest bar. But those who were on this diet that was rich in
high in flaxseed,
English walnuts, high in these greens, you can see that they had less than a third the risk of dying after their first heart attack. 70% lower risk, in fact.
Boy, if I would have found out about that and I was on that American Heart Association diet, I'd say stop.
That's exactly right. In fact, they had to, this is not a study you can continue. When you see this great a difference between the two groups, you cannot continue ethically.
It's malpractice.
Absolutely.
Okay. So that's an essential protective fat, the omega-3 fatty acid. Is that right?
Yeah, actually what they've shown is that if you take in a good quantity of these essential fats, the omega-3 fats, for example, as we've been saying again, from flaxseed, from English walnuts, from dark leafy greens, or many people would take in fish to get these, you actually stabilize the membranes of the heart cell. You lower the irritability of those heart muscle cells, and your risk of having a dangerous rhythm after a heart attack is reduced, and you actually have lower risk of sudden death.
So there are essential fatty acids that actually are putting out the fire in the arteries.
Putting out the fire in the arteries.
And those essential ones are omega-3. What else?
Alpha-linolenic acid, and it's concentrated in those three food groups.
English walnuts, flaxseed, and
dark leafy greens.
Dark leafy greens. Well, fascinating. So people should go out and immediately start eating fish then, probably, because that's where omega-3s are, aren't they?
Well, it's like this. Fish can actually help the omega-3 fats in fish, and there are two of them that are very important. And these two omega-3 fats in fish are very helpful because they can actually prevent blood clots from forming. And so if you want to live on a standard American diet and have lots of cholesterol in your bloodstream and have lots of cholesterol moving into your arteries, then you want to make sure that you don't, when those cholesterol deposits break off, you want to make sure that a blood clot doesn't form. And so eating fish can actually help prevent that. But the best thing you can do is to prevent those plaques, those cholesterol lesions, from forming in the first place. So you won't need to take a fish oil, for example. That's the safest approach. I mean, it's dangerous to have a plaque form in your artery and have it rupture. And what you want to do is prevent the plaque that can rupture. And the way you do that is to eat a plant-based diet You don't need fish to prevent this heart disease.
Now, what if you already have the heart disease and you want to reverse it, or should I say stop it? Is it okay for fish then, or plants, or are they better than?
Well, fish is not the best choice, because if you're on a diet that is rich in beans, whole grains, fruits, vegetables, nuts, and seeds, and you add fish to it, you're going to have a higher cholesterol level.
I see.
You're going to have a higher protein level. Animal protein can also raise cholesterol.
So maximizing my essential fat intake is paramount to putting out this fire in my vessels. How do I maximize that? I think you have some graphics to show us to talk about that.
Yeah, let's take a look at the first graphic. If you want to maximize the protection of these essential fats, you want to get more plant material into your diet. You want to replace the meat and milk and eggs and cheese, because those have the fats that promote inflammation, the arachidonic acid, for example, and you want to replace them with the plant foods, which are the foods that have the essential fats.
Vegetables, beans, grains,
whole
nuts.
grains,
Okay.
fruits, nuts, and seeds.
So this is one way. Another way to maximize it?
Another way to maximize the essential fats would be, as we've been mentioning, those 2 level tablespoons of the whole flax seeds, blonde or brown, freshly ground in a coffee grinder.
Are those tasty? Do they taste good?
Actually, they have kind of a nutty flavor, and some people who think that the dark ones have maybe a little bit of a sharp flavor have found that the blonde seeds have a even more mild flavor.
So how do you eat them? Put them on your ice cream?
I actually take, that's the first thing I do in the morning before breakfast, is I take those 2 tablespoons of whole flax seeds, put them in the coffee grinder, whiz them up, put them under my cereal, and I hardly even know that they're there.
Oh, so you hide them?
Hide them, basically. You can put them in bread, you can put them in muffins, you can put them in soup. You can use flaxseed, frankly, add a little bit of water to that flaxseed. It's a wonderful binder. It can actually be an egg replacer. You can use it in recipes. So many different uses.
Okay, what's another way to maximize that we have on our graphic?
Well, another way, of course...
Eat 1 ounce of...
English walnuts, yeah. An ounce of English walnuts would be about a handful, but you can still close your fingers over those nuts. In other words, you don't have an open hand full of nuts, but you can close your fingers over all those nuts. That's about an ounce. And an ounce several times a week can just add more of these essential fatty acids. And by the way, if we have listeners who have children or who are pregnant, expecting moms or breastfeeding moms, it's very important that the developing child's brain be richly endowed with omega-3 fats. Because
Make them smarter?
Absolutely it does. In fact, breast milk is one of the greatest sources of omega-3 fat. And you don't get that in cow's milk. So children that are breastfed are actually at a higher level of IQ when they test them. And it's because they are being fed these brain-building fats, and it's one of the prominent fats in the brain is the omega-3.
Okay, another way to maximize these essential fats that we have.
Well, as we mentioned earlier, well, maybe we didn't mention it, but one of the things you can do to limit the benefit of omega-3 fats is to take in so many omega-6 fats that you...
That's in processed oils?
That's processed oils, corn oil, safflower oil, these different oils, refined oils, and you can take in so much omega-6 fat in the form of those processed oils that it totally takes up the enzyme that's needed to work on the omega-3 fat from the flaxseed, English walnuts, and greens, and those essential fats can't be beneficial at reducing inflammation.
So decrease the
competition.
Competition,
Exactly.
so it can flourish. Anything else here to maximize we have on our list?
Well, actually they've discovered if you can eat fats that are rich in monounsaturated oils. Olives, avocado, hazelnuts, almonds, peanuts, pecans, soybeans.
I like all those.
These monounsaturated fats actually have less of the omega-6 fat that competes with the omega-3 that you're taking in.
That doesn't sound like something that's going to be hard to do at all. Lots of people like these foods you've mentioned, and they're protective against the fire in our arteries.
Absolutely.
You know, many times people say, well, I'm just going to go to the doctor, I'm going to get checked out. I'm sure not too many doctors ask about these different tests that you've given. Are you eating this? Are you doing this? These are all things we can do. Many times they'll just say, well, let's do an angiogram and make sure that's okay, and then they just say it's a clean bill of health. Anything wrong with that approach?
Well, actually, there's been a reformation, so to speak, in the understanding of coronary disease. We used to think it was a disease of the lumen, where the blood is flowing. In other words, we thought that over the years, more and more cholesterol filled up the inside of your artery, and finally it shut off, and you got a heart attack and a cessation of blood flow. But what they've discovered recently with a new technique, which is called intravascular ultrasound, where they actually take a coronary catheter, they put it inside your coronary artery, and on the end is an ultrasound probe that rotates at rapid speed, and it actually takes pictures of the wall of the coronary artery in living patients. It's like real-time living microscopy in a living patient with coronary disease. And what they've discovered is that the cholesterol that actually encroaches on the blood flow represents only about 1% of the coronary artery disease burden in a patient. In fact, 95 to 99% of the coronary disease is not impeding on the blood flow. It's actually in the wall of the artery. What they've discovered is that the coronary artery, as this disease advances, as you put more cholesterol into your artery wall, the coronary is able to remodel. In other words, it's able to keep the blood flow space constant, even though there could be huge amounts of cholesterol plaque in the artery wall. And that is completely missed on an angiogram, because all you see is that remodeled normal width coronary, and you're missing 95 to 99% of the disease.
What's the best test you can have to decide whether or not you have fire in your arteries, coronary artery disease?
Frankly, there are two tests, very simple, that would actually be the best test to predict your future risk of a coronary event.
They are?
And that would be a total cholesterol divided by your good cholesterol, or HDL cholesterol. So you just take your total cholesterol, you divide it by your good cholesterol.
It gives you that ratio.
That number, and then the C-reactive protein. Those two tests together, C-reactive protein should be less than 1. Your ratio should be less than 4, total cholesterol to HDL, less than 4, or even better, less than 3. Those two things together will give you your best information about future risk of a heart attack.
So people can go to their doctors, they can schedule that test. It's something that all doctors, they'll know about if they go talk to them about it.
Absolutely. More and more doctors are testing for C-reactive protein.
So then what about angiograms? Should we ever have them?
Well, angiograms can be helpful because if the coronary narrowing is very tight, you may need to do an angioplasty.
But those are really stable plaques, and that's not really going to...
That's right. Angioplasty has never been shown to lower death from heart disease because it's only treating 1 to 5% of the disease. Those lesions that are shown on the angiogram are most stable.
So C-reactive and cholesterol. We've been talking with Dr. Tim Arnott. He's a physician at the Lifestyle Center of America in Oklahoma. They do programs addressing this and also programs in the community. We're glad you've joined us and hope you have health for a lifetime.